Hi everyone, welcome back to the another episode and hopefully you enjoy guys. Sorry for late. Actually I am too busy for last couple of days so I am not able to do it but I can't promise you but I would like to assure you for the further videos and further lectures, right? So first of all today our topic is the anesthesia, right? So, first of all, we have to know what is the anesthesia. So, in a short word, it's a paralysis of a body part or region, right? So, if you are going to doctors and if you are injured, if you are wounded, then the doctor gives you a certain injection to reduce your pain of the certain places. That is the anesthesia actually, and I have created some figures to g- to understand you. I think you can understand with the figure, right? So first of all, it is you, and you comes to doctor when you have problem. As example, you might have problem in your hand. As example, you are playing and a wound is found in your left hand uh, finger, right? So you comes to doctor. Here at first there was no concept before 1846 about the anesthesia. So uh, after 1846 it was the conceptualized and about the anesthesia, right? So now you going to doctors and obviously doctors asked first before asking the nurse to dressing the places of your wound. The doctor gives you an injection to reduce the pain. That is the injection to reduce the pain of your hand in hand finger, right? So as a result your finger pain was must be reduced. So this was the anesthesia. So it was firstly here I am written that is a before as I mentioned before that is a 1840. Before 1846 there was no conception about anesthesia. After 1846, as this way a patient comes to Dr. William T.G. Morton, who was a dentist at Boston, and they asked the doctor for reduce the pain during surgeries. So the Dr. William T.G. Morton uses sulfuric ether as the anesthetic agent for the first time, right? So this is the anesthetic agent for the first time used by Dr. William T.G. Morton, who was a dentist at Boston at 1846. So here the anesthesia conceptualized and it was developed through the decades and through the centuries. Right now, anesthesia is the most developed part, right? So here I have written the anesthesia. What is the anesthesia? To paralysis of certain body part, as I mentioned before. Right now, anesthesia can be divided into mainly into two parts. That is the regional anesthesia and general anesthesia. So if you can you can think it in this way that if your finger is injury is found in your finger, then it would not need to totally paralyze your hand or totally paralyzed you to dressing the certain places, right? So it is only for the particular part it is used, and particularly used to paralyze the particular part which is injured, right? So as I mentioned before, the case that is a injury found in your hand, that is a on finger, then you obviously use regional anesthesia, right? So here is the regional anesthesia. So if it can, right now the right now it can be divided, right? So the regional means actually you have to think it in a different way. It can be also divided into three parts somewhere, but I think local anesthesia, it's mentioned as a local, and the spinal anesthesia, right? So it can be divided into both of the parts, that is a spinal anesthesia and local anesthesia. So as I mentioned the case, that is a local anesthesia. But if you think uh, about your leg, right? So in your leg, your tibia was fractured, right? A fracture found at your tibia, tibia fracture. Then what should be procedure? Then you can't be paralyzed totally, right? So we can, if a doctor going for the totally paralyzed body, then he have to take care your total responsibilities or your total awakeness, your consciousness during notice. But and it would not be a easy procedure in every OT, right? So it is a simple OT to do a spinal anesthesia for our below umbilical body parts, right? So here it is, we discuss further in a different video, that is a spinal anesthesia video. And lastly we can, as I mentioned, that is a general anesthesia, right? So it is a main part of the anesthesia and one a major side of the anesthesia. So here a patient's body is fully paralyzed. You have to control patient's body is all controlled. That is the breathing, right? Through ventilator. So here is the concept of the ventilator used. So from here it is a different portion. So we would like to discuss it in the next video, in the next separate video. For right now we would like to complete, that is a local anesthesia. I mentioned a case, the first portion about you are the individual goes to doctor for your injury on your hand. So right now the the doctor gives the injection in the certain places of the certain finger of your hand. So the finger would be paralyzed, and you can't able to sense the further procedure on the finger, right? So as it is, you see it is the procedure going on your certain place, a local place of your body. So it is called as the local anesthesia, right? So for that reason it can be known as the local anesthesia. So in a local anesthesia, what should be the agent of local anesthetic, and what should be the agent works as local anesthetic? That is the lignocaine and lignocaine adrenaline mainly, and nextly bupivacaine and the ropivacaine. So here the case about lignocaine and lignocaine adrenaline, we used mostly for localized a certain place of our body, right? So for that reason it is used. Hopefully local anesthesia and you can understand well. So for right now I would like to say bye, and obviously the next part is the spinal anesthesia, and here is the general anesthesia in a separate lecture. But before discussing general anesthesia, you have to know couple of things, that is the anesthesia nation, right? Couple of drugs and anesthesia procedure, right? So it can be divided into three parts, obviously, and spinal anesthesia is divided into single part video, that is I can show you, but it would be a longer video. So for right now I would like to say bye bye. If you like the video, then please subscribe OTpedia. Thank you.